wait a minute. Are we filming this?
Yeah, she's.
Oh, I'm sorry, go ahead.
Specifically about neurological disorders. This happened because my mom's got epilepsy, and she's had it for years, and she's going to do all this stuff, but actually, like, is there a way that we could get it where she doesn't have to go through constant, medication and appointments? So, okay, so what is gene therapy?
Just say next.
Gene therapy is you're treating disorders caused by a genetic mutation. Either the gene is wrong and it's doing something you don't want it to, or it's creating something that you should not have in excess, or it's not creating enough. The gene therapy replaces this genetic disorder, genetic defect, or it controls it. Next. And usually through clinical trials and preclinical trials, they found that viral factors look very good in delivering this method to the brain. And real quick, just walking through the process. You have your cells, because you have to target specific tissues. And then you have the virus. And they put the good gene in the virus after they've taken away the pathogenic portion of the virus. And they insert it into the person, either like the bloodstream, or if they're a specific part of the brain, they'll get it closer so it can go to where they need it. So viral vectors. Like I said, they're viruses, they're modified. They take away all the pathogenic parts and really try to. Sometimes it doesn't always work. They have issues where people will end up with complications of the disease that the virus caused. And they insert the human gene and then they enter into the body. Certain types are used for specific purposes because of the size or the function of the virus itself. I actually have a chart. This is an overall chart of all the different types of gene therapies, which viruses are used specifically the most.
Very nice, Teresa.
But for targeting the brain, the nervous system, they found that adenovirus, adeno-associated, herpes simplex, and lentivirus are the best. And that's specifically because of the size of the particle. Okay, we're talking about practical applications, clinical and preclinical trials. Preclinical trials, they've done quite a bit, and that's animal testing. Of course, with animal testing, they have to file guidelines, regulations from what countries have had. I've read articles about ones that were done like in Japan and ones that were done in the States. They've had quite a bit of success treating the animals with the different gene therapies and seeing how effective it is. When they moved on to clinical trials, after they hit all of the points that they have to get to before they move on, they didn't have as much success. Obviously, humans are a little bit more complicated than animals. It actually was more dangerous because of all the complications that came around from the immune system and the virus itself that they were using. There are 4 phases in a clinical trial. It starts off with a really small group, and as they reach all of their points, they get to expand until they have like 100 samples, and then once they go through submitting it to the drug administration, they can sell the drug over the counter. And I have a little clip about specifically a...
Yeah, just click on it. No, honey, go back and click on
I still have a video about a clinical trial application.
Parkinson's disease affects millions of people worldwide. The main symptoms are caused by degeneration of brain cells that control movement. These cells originate in the substantia nigra and communicate with the putamen and caudate. As these cells degenerate, they lose their ability to produce dopamine and to communicate properly with other cells. Current medicines improve Parkinson's symptoms for several years, but become ineffective as the disease progresses. An experimental biopharmaceutical drug called SARA-120 has been safely tested in over 60 people with Parkinson's disease. SARA-120 is intended to restore damaged dopamine cells and protect them from further degeneration. SARA-120 consists of a bioengineered viral vector containing only the gene for human nurturing, a naturally occurring neurotrophic factor. This viral vector serves as a carrier for delivering nurturant to brain cells. Neurosurgeons accurately deliver SARA-120 to the areas of the brain where neurons are degenerating. SARA-120 then enters the neurons, inducing them to produce a continuous, lifelong supply of nurturin. Nurturin is expected to restore the function of the neurons and protect them from further degeneration, hence potentially reducing the severity of symptoms and slowing disease progression. A new study is now underway to test the potential benefits and safety of SARA-120 in Parkinson's disease. For more information, please visit www.saragene.com.
Current tab. There we go.
Are you gonna resume slideshow, I think, up there?
Yeah.
Okay. So, like they said, gene therapy at this stage is still very experimental. There's issues with gene therapy problems, especially with the neurological portion, the blood-brain barrier. In your skull, it's very hard for anything to get from the bloodstream into your brain because the pores that allow it to get past are very small. So the particle has to be small, has to be lipid soluble, and it has to have a low charge. Those are the only type of particles that are ever going to get to the brain.
Okay.
So that's why the specific viruses they have, they fit those criteria so they can actually get through the blood-brain barrier. So that's like the first thing they have to get through. Second, another issue is immune response. Because they're viruses, body doesn't like foreign objects coming in. So anytime something comes in, there's going to be an immune response. You're going to build up antibodies. As you take the gene therapy and you keep getting it put into your body, the antibodies will get rid of the therapy and it will become less effective over time. Also, there's just, even if you don't have a lot of antibodies, the body has a process just to get rid of foreign objects that it doesn't want into your system. It's very dangerous to immune response. There was clinical trials in the 90s. There was actually a death of a teenager who was participating in one of the studies. And for a really long time, they were not even doing clinical studies because they were so afraid that there was going to be other issues because along with the death, there were a bunch of trials where people were developing complications from the gene therapy, either from the virus or from having too much of a specific gene expressed. Okay, so why work towards something if it can be dangerous?
We're almost at 15 minutes. It's supposed to be hold on. We have to keep it at 10 minutes.
Okay, so
I mean, we have to because otherwise we're not going to get through everybody. Okay? Go ahead.
current treatment does the symptoms not a cure. So like my mom, she's got issues and she's got to be on medication, doctor appointments all the time, the rest of her life. It's really pricey. Okay. Cure the disease. Patients can live longer because a lot of the neurological disorders, it cuts a person's life short. Less invasive, because when you're doing stuff with the brain, it's surgery and there's like the only way you can get in there, and that's really dicey sometimes. Lower long-term costs. Instead of doing a couple of pricey treatments once or twice, not as much as lifelong payments for all the services you need.
Okay. One question. By the way, for somebody who doesn't